This episode of the Beauty Industry Podcast was brought to you by Candela Medical, growing your practice with the latest treatment technology, science, results, and trust. Hello and welcome to the Beauty Industry Podcast, your online support community for the professional beauty industry. I am your host, founding director of Beauty Industry, Tamara Reid. Here we are closing the competitive gap and speaking your language. This is a platform created and dedicated to the professional beauty industry, valuing community over competition. We serve to help connect you with inspiration from industry experts, expand your knowledge through educational pieces, and bring you the latest in product and technology innovation. This is Beauty Industry. Today, my guest is Matthew Green, Managing Director of Candela Medical. As business owners, onboarding a product range, device, or brand into the business can be daunting. Where do we start? What do we compare? Do we purely look at price, or is popularity something that we should be measuring? Armed with all of these questions and more from our Facebook community, we thought, why not go direct to the source to find out with none other than Matthew Green, Managing Director of Candela himself. Matthew is a pharmacist by profession who initially worked for 15 years in community and hospital pharmacy, 10 of those years owning his own business in Sydney. After selling his pharmacy, Matthew then worked for a startup Dutch pharmaceutical company before moving into the cosmeceutical space, which was his foray into the aesthetic industry, which you'll hear more about today. Matthew then began his career with Candela Medical, initially as a business development manager, and for the 4 years as the Australian and New Zealand managing director. Today, Matthew shares with us many impartial insights into the world of purchasing devices. From where to start when searching for a device, support and training, all the way through to the misconceptions often associated with device technology. This is a great episode for those looking to purchase new equipment, or for those of you who already have devices in your space. This conversation provides brilliant metrics around pricing your treatment menu for greater return on investment and increased profitability, expectations you should have from your device partnership, servicing or breakdowns, and 2, what it looks like for you if you're considering buying or selling a second-hand device. Here's Matthew and I for Beauty Industry. Matthew, welcome to the Beauty Industry Podcast.
Thank you very much. It's wonderful to be here.
Likewise in having you. Thank you so much. We start all of our episodes right back at the very beginning of our guest career. And I'd love to ask that of you. How did you find your way merging into the professional beauty and aesthetic industry?
Well, my background is pharmacy. So after a successful career in hospital and then retail pharmacy, I sold my business. And I moved into the pharmaceutical industry, working for a startup, a European startup. And that led me into the cosmeceutical space, which was kind of my bridge between traditional pharmaceutical and then the aesthetics industry. And then I was headhunted to join Candela in about 7 years ago, in late 2013.
Fantastic. Headhunted is a very special thing to be had and to be on the end of receiving in our industry. Tell me about your role with Candela now.
So I'm the Managing Director of Australia, New Zealand and South Pacific. I came to the business as a BDM and then was promoted into sales management and then ultimately to country management 4 years ago. So Candela's got a really good culture of promoting from within. So they've been a very good company to work for, and it's been an exciting time.
Yeah, brilliant. And such a fast trajectory as well for such an incredible brand. I mean, we are seeing so much innovation and so much technology. I think that's one of the best things to come out of 2020 is that our aesthetic industry is getting really excited and they're moving with the technology. And we can definitely attribute some of that to Candela, which is really exciting to be on the front line of. I want this conversation to kind of travel in the pathway today of almost like a myth-busting kind of conversation, because we get asked copious amounts of questions about devices and technology and all of the millions of thoughts and feelings around that. So I kind of want to start at the beginning with you today and just ask you the biggest question that we are asked, which is, where does one start when purchasing a device? And I'd love to get your advice on that for business owners who are looking to put something technology based into their space.
Sure. The best place to start is with your customers. So the very first, I've often recommended to people that if they're thinking about adding something in, to conduct a survey within their own customer base. I'm thinking about adding, a particular modality or a particular treatment to my offering. What do you think about that? A question to their customers. It can be done at point of sale, maybe when they're booking for their next appointment, or, buying some retail at the counter or whatever. You can say, would you mind, can I just quickly ask you a question? And you start to gather that information, to your essentially market research with your own customer base, and to determine, would they support me if I was to add this new treatment in? Because what you don't want is to buy an amazing piece of equipment and suddenly discover that your customers, they're not interested in paying you to perform it. So start with your customers and assess what treatments you're not offering at the moment that they would like you to offer, and that they will support you on if you do.
Amazing. Such a great place to start. I mean, for us being on the other side, not being in the business, it seems like a very logical place to start. But when you're a business owner and you're constantly chasing your tail, perhaps you're even performing treatments on the floor, we kind of hear a little niggle from a client saying, oh, I'd like this treatment. Or, we might see at a beauty expo, or we might see in a magazine something, and then we get sparked the interest. Therefore, we start doing the research. But a lot of business owners don't actually qualify that research or the purchase with their clients, which seems kind of backwards to us. So definitely that's perfect.
Well, there's a lot of people in the industry who are extremely passionate, people who just love skin, or maybe they're really passionate about acne because they had acne as a teenager and that's their thing. And, they take an interest in the technology that's available that can help with that. But they forget the piece that, do I have a market myself in my clinic for that? Even if I am passionate for it, that may not be enough to make it commercially successful. So tick that box first.
Yeah, absolutely. And there are so many really simple ways in which you can just qualify that survey with your clients. I mean, definitely asking them during treatment or during conversation, or email, SMS, private Facebook groups. I mean, VIP, different catchments of, your top 10 or top 20 clients. So even though it sounds quite formal, survey your clients, it can be just as easy as having a conversation.
Yeah. You literally just want to assess what demand you have. Or even if you aren't thinking about something, you could just have a very general open-ended question saying, is there anything you've heard about that you would like me to offer? You may not even have an idea in your head, but just find out if your customers, it could be that they're seeing you for one treatment, but they're going to a different business for something else because you don't offer it and you don't even know about it. But if you put it out there, you never know what you might find.
Absolutely. I'm interested to know what some of the most common questions you're asked by business owners are about devices, because I'm sure they're knocking down your doors asking many, many weird and wonderful things.
The most common questions would be, well, obviously cost. It is capital equipment, so it's very, it's cost intensive. So that's the first thing. The second thing that pops up, particularly in Australia and New Zealand, is what clinical training is provided. One of the things that I'm always impressed about, particularly with dermal therapists and beauty therapists, is they just love training. They love getting training. They love getting new skills. They love keeping up to date with the latest trends. And certainly training is a huge piece. The other questions are there ongoing costs after I buy the device? The consumables, what are the costs after the warranty expires, etc. So they're probably the most common things that we get asked about devices.
Yes. And I wanted to ask you about that aspect of a device purchase, whereas, you get the support, you get the training. And we know that it's so essential for our therapists and our practitioners and clinicians to be trained on these devices. However, I think sometimes a business owner might be wrapped up so much in the purchase that they forget to ask, how often am I going to see somebody, or what does that training look like? I mean, yeah. I'd love to ask you at Candela specifically, I mean, are we online? Are we in person? What's that call cycle like?
So I mean, every company is different, but back in 2017, we moved to a 3-year warranty. The industry standard is 1. And one of the things that was very important to me at the time was that for that 3 years, clinical training features as part of that relationship. So typically you'll receive intensive in-clinic training in your business when the device is delivered. And then we offer continuing access for those 3 years, all included in the original purchase price of the device. Now, with COVID, of course, everybody has had to pivot to an online platform. So we have supplemented our in-field and in-clinic activities with our dedicated clinical education team with online trainings, which can be done on an as-needed basis, where we set up something custom for a business, or there's lots of pre-recorded webinars which they can access from an online database. So it's both. We're kind of in that age. And what a lot of people have discovered during this new period is, even when we reopened in June, they actually preferred that their staff accessed online resources, sometimes out of hours, so there was less disruption to standard business trading hours. And so we're here to be agile and to provide our customers with the support that they need.
Yeah, incredible. And even I'm thinking for the regional accounts, say, up in Bundaberg or Rockhampton or down in Tassie, it's really difficult sometimes, and also just not costly nor time efficient to travel out, do an hour or two of training, block off a whole entire appointment book. So that online aspect, as I was saying before, like coming into moving virtually, is such a great thing that I love that business owners have really taken on board and pivoted, should we say, moving into the year 2021 too.
Yeah, it's a big cost for both sides. I mean, you can imagine from our side having to have dedicated training staff full-time, and all of the costs associated with flying them all around the place is a very expensive proposition. But also from our customers' point of view, blocking out a room for hours. Every hour that their team are in there getting trained is an hour that they're not generating revenue. So we understand that. So we're trying to work together and find something which balances the cost base for both sides.
Yeah, absolutely. What are some misconceptions around purchasing devices in our industry? I know a lot of people think that perhaps training should just come with it, but maybe it doesn't. It's an additional cost we find out later down the track. What do you see to be the biggest misconception?
I think one of the biggest misconceptions is that purchasing from a small distributor is really no different than purchasing from a major manufacturer. And the reason I raise that point is that there are some fantastic distributors in the industry, don't get me wrong, who have wonderful relationships with their customers and do a great job. But there are some restrictions with respect to post-sale support. When you buy directly from the company that actually made the device, their technical staff, their clinical staff are trained by the very company that made the machine. You're getting it from the horse's mouth, so as to speak. If you purchase from a small distributor, they may lose the contract to distribute that product. They may not be able to access parts. And the staff they have may have to be experts in a whole variety of different products from all sorts of different manufacturers. So often they either don't have some of these dedicated specialists, or the information is a little more generic. The other misconception in the industry is that, if you've decided in your business that you want to buy a particular type of machine, that you can talk to 5 different salespeople from 5 different companies and compare devices that are like for like. So something like IPL, for instance, or a picosecond laser. And you're thinking, well, I've identified the category I want, so now I'll just compare all these things. What a lot of people don't realise is that even though something may look like it's in the same category, they can be vastly, vastly different devices. And so you really need to, my advice is to get your information from the salespeople from the different companies, and then find a completely independent source to verify what you're being told. Find someone who owns these machines, who paid for it with their own money, who's been using it for years, who will talk to you independently of the manufacturer or the salesperson, and verify what you've been told.
Yes, that is such great advice. I mean, in our community alone, I'm just thinking of all of the different threads that have been started, which says, I want this, say, laser machine A versus this laser machine B. I've tried to find out some research. which one do you think, and you're kind of just blindly asking 7,000 people in a group which one they think. And I kind of think it's very backwards, because I've just gone through the house purchasing process myself. I would never ask 7,000 people, should I buy a townhouse or should I buy a unit? So it seems very foreign to me that we're asking, and putting such a big decision into the hands of others. And generally that decision is going to be made on popularity, because one brand might be more popular than another. So what you're saying there is actually do a little bit more research. We can't compare apples with oranges. We really need to actually figure out the different metrics of each device.
That's right. And it goes back to our first point about talking to your own customers. Once you've identified the need in your business for a particular treatment, you then determine, okay, my customers have said they're happy to have this particular treatment. I also need to know what they'd be willing to pay me. What's the treatment price point? Once you know and you can assess the demand for the treatment, the volume of treatments, the amount of revenue you think you can generate, you can then work backwards and ask the companies to say, fine, you put me in touch with someone who has a business like mine, a similar clientele in a similar area, similar demographics, socioeconomics, etc., where their experience is probably going to be similar to mine if I proceed with you. And then you talk to that person completely independently and you make your own decision, because it's not the spray and pray approach like going into a group on Facebook. You're actually talking to someone whose real world experience has some relevance to yours.
Yeah. Oh my goodness. That is such great advice. Somebody who's been there or who's currently there, who's doing it, who has that real life testimonial can say, well, we've got this portion of clients who thought that, it might have been too expensive when we first initially introduced it on our menu. However, we've changed these different prices or whatever that looks like, add-on, value add, etc. And now we're getting a much better return.
Yeah, and typically you'll want to talk to someone interstate because they won't see you as a threat.
Yes, good
I'll
idea.
point out that this is the way that specialists have bought devices for decades. A dermatologist will just get on the phone to a peer and say, I'm thinking about this, what do you think? And they really trust the advice that they're given by their peers in that profession. And so there's nothing stopping a business owner or a beauty therapist doing exactly the same thing. Find someone like-minded whose experience is relevant to you.
Amazing. And I also encourage anybody who's listening to do that in our community. If you say, I'm looking at purchasing this machine, I'd love to chat to somebody who currently has it and who would be willing to give me some feedback and testimonials, please do reach out to them. That's exactly what our community is for. I love that type of conversation. Then, as you said before, the spray and pray, just hoping for,
It's too confusing.
Yeah, exactly right. So in terms of price then, because this is something that can be really varied, different modalities, different manufacturers, different distributors. I mean, a lot of business owners go, okay, I've got X amount of money to spend and I can't go outside that bubble. So it does limit them. But others don't understand the difference between something that costs 100,000 versus something that costs 300,000, for example. And sometimes we just see that price as a barrier to entry. But in terms of the price range, what kind of metrics should we actually be measuring to measure the price, not just seeing the dollar sign at the front of it?
Yeah, so the mistake that people make, and let me give you a practical example. Let's say you wanted to add tattoo removal into your treatment offering, but you have a very fixed budget. So I want to be in the tattoo removal space, but I've got X dollars to spend. That's actually the wrong way to go, because you are now constraining yourself not on what the best available technology is, but just what the price that fits your budget. The way that people should go is to have a look at the ratio between the purchase price of the device and the treatment price they can charge. Because if you think about it, if you can go option A or option B, one's much more expensive than the other, but the treatment price is the same, well, of course you're going to go with option A. But the way it should work is the more you spend on a device, it should enable you to have a higher price point treatment. So even though you might spend a lot more to get the machine in, you'll be able to charge 2 or 3 times as much as a competitor with a cheaper device because of what you can do with it, because of the reputation of that equipment in the market, because of the marketing might and support of the manufacturer. So that's what you need to look at. It costs me this, but I can charge that for it. So, and if you use that way of assessing price, the purchase price doesn't really matter as much because it's reflected in the treatment price. So I guess, the question of is it okay to purchase a very expensive device? Are you potentially wasting your money? That answers the question, as long as you can charge a lot more for what it does. The other thing I would say to people is perform a 3 to 5 year full cost of ownership. One of the biggest mistakes that people make with capital equipment in our industry is they just look at what does it cost to get it in the door on day one. They forget that this is not a one-off thing. That's actually the easy bit for both the company and their customer. The difficult bit is supporting them for years to come. So do a minimum of a 3-year cost of ownership. What does it cost to get it in? What does it cost to buy all the consumables? Do I have to take service contracts out? What is every dollar it's likely to cost me for 3 years? Then look at your likely treatment revenues and have a look at your return on investment that way. And if you do that, even something that looks quite cheap up front, by the time you factor in all those hidden costs and the maintenance costs and the exclusions that the company might have, you'll suddenly discover that after 3 years, what it's really going to cost you looks very different.
Yes, interesting. And I've just been thinking there while you've been talking, it's always nice to understand how much of a treatment you need to perform to understand how much it's going to outweigh the price. So, for example, if you have a device which you're getting into your business, you might say, okay, well, if I charge X amount for it, I'm going to need to perform Y treatments.
Yes.
Or if I charge Y amount, I'm going to need to perform Z amount of treatments, which is quite nice because I think, especially if I can speak on behalf of many beauty business owners, we are not great at the maths or the financial side. Hence, thank goodness we have bookkeepers and accountants in our life. But if we can say, okay, instead of looking at this huge amount of money which we're about to invest into our business, we can look at the amount of treatments which we need to perform. And then we go, okay, how do I get those treatments into my business? Do I need to do a VIP day where we're going to sell packages and we're going to do special add-ons? Or do I need to implement this treatment into my marketing and promotional calendar for the next 6 to 12 months? And once you go, okay, we actually only need 20 clients on a course of 10 or 12 treatments, that's really easily done. You call up your top 20 VIP clients, say, hey, we've got this fantastic new modality device into our business. I would love to come and invite you for a special VIP treatment. They come, they know you, they like you, they trust you. They buy the package. All of a sudden, your 20 treatments is your return on investment.
Yes, absolutely. But also remember that you want to, in an ideal world, keep the treatment price as high as possible and the required volumes as low as possible. Because with increased volumes means more therapists, more clinic hours, more consumable purchases, more marketing spend. Whereas if you have a smaller number of people being treated at a much higher price point because you value add, because you really sell the efficacy of the treatment and what it can do for them, you have great consultation abilities, good staff, you don't need as many treatment rooms, as many staff. Your cost base is constrained because you have a much higher margin on a per treatment basis. So you can always change that and lower your price and increase the volume, but it's very difficult to go the other way.
Absolutely. And this could almost be a whole nother podcast for another day, but understanding your break even so that, again, you're not just asking any old people on Facebook, hey, what do you charge? You should actually understand what your outgoings are, what your expenses are, your overheads, and then you put a price on it and go, okay, now how much do I need to make that profit on top? And then you find your price based on your numbers, not on anyone else's just old advice.
And once again, it goes back to our first discussion about talking to your own customers. Would you be interested in having this treatment with me? And what would you feel comfortable paying? And that's where you need to start with your own customers, because you might buy some beautiful piece of equipment and have this wonderful treatment available, and you've just priced it too high and your customers they're not ready for it. So it is a balancing act for sure.
Yeah, fantastic. And in terms of support, as we were mentioning before, are these types of things, looking at, your ROI and your costing and your break evens, are they things that your business development manager, account manager, or rep, or whatever you want to call the person, are they things that they can help you with, or are we on our own here?
So this is a really good place to start. So if your first experience with a company and the salesperson who comes to see you is straight into why their stuff is amazing and why all the competitors are bad, if it's that simple and black and white and transactional, and you're forgotten in the process, if the benefit to you is forgotten, run screaming from the room. What you want to do, and there's a common problem with capital equipment salespeople in our industry. I think the old adage goes that the easiest way to get rid of a BDM from a laser company is to buy a laser. But unlike for instance, with cosmeceuticals or your makeup or your waxing supplier or all those other people who you see on a 4 to 6 week call cycle who really partner with you, often device people sell you something and you don't see them again unless it breaks or you need something. So establish your expectations right from the first meeting. I'm looking for a partner. I want to buy this device. I want to own it for years. I want to be very commercially successful. I want to retain my clientele by giving them something new and interesting. And I also want to do something which is professionally satisfying for me. I want to be using this thing and loving what I can do with it. It's a partnership. And that's the very first place to start. So there are expectations around, regular clinical education. And yes, to answer your question, the BDM should sit down with you and have this exact conversation. Let's nut out what treatments you can offer. Who's currently doing it? What are they charging? How many do you think you could do a day, a week? What revenues are we looking at? Do they have finance partners for you? Can they figure out what the likely monthly repayment's going to be for you? Can they drill it right down to, it's going to cost you this much a day to pay your finance on this machine. You need to do X treatments a week to make sure you're ahead. It should be a very simple, bulletproof business conversation. That's where you should start.
Yes. And coming back to seeking those testimonials on how your clients are enjoying the treatment from your competitors, well, how is your competitor enjoying that relationship and that partnership with the device manufacturer?
Yeah, that's exactly right. One of the important things, and it is difficult from our side of the industry, obviously, to keep everybody happy because these are devices after all, but talk to people about what's it been like 2 years in, 3 years in. Does it break down? Are they responsive? It's a difficult thing to do from our side of the industry, because every time the machine goes down, every hour it's costing our customers money that it's not working. So yes, you need to find out from someone, and you want to find someone who gives you the warts and all assessment. Yeah, we bought it. Yeah, on balance, it's good. Yes, we're happy. We did have a few hiccups. It wasn't ideal. These are the things that went wrong. Get a really honest appraisal. Go in with your eyes open.
Yeah, absolutely. And on that point, you were saying, about the machines breaking down. This is something that we get tons and tons of questions on. How much importance should a business owner place on servicing their devices? Because again, we're not great at understanding our devices and the intricacies that they have in our business. And I know even for me, servicing my car, it's due soon. And I'm like, oh, how far can I push that out? And I know this to be true of business owners and their devices. I mean, from a 1 to 10, what are we looking at? It should be 10, right?
Well, honestly, it's very, very dependent on the device. There are some devices out there that if you look after them, you follow the basic maintenance schedule, you clean it the way it's supposed to be cleaned, and you treat it with respect, they can be very robust with very little preventative maintenance. But then there can be other devices that are extremely complex and require perhaps a quarterly visit from a technician to tweak them and adjust things and keep them in perfect working order. It's highly variable based on the machine and the company. But as a general statement, what I'd say is that it is business critical to have these things serviced. You can have the best device in the world, but if it's broken down and you can't generate revenue, then what use is it? And talk to any company that you're looking at purchasing from and ask them what the preventative maintenance schedule is. What is the manufacturer's recommended maintenance schedule? Is it once a year? Is it twice a year? Once every 2 years? What does it involve? Is it covered by the warranty? Is it an extra that I have to pay for? How much is it going to cost me? And most importantly, are you going to service it in my business? Or does it have to get picked up and sent to some service centre somewhere and done and then sent back to me? How long does that take? What's the downtime? If you come and service it here, do you need 1 hour of clinic time, 2 hours, half a day? So get all of that information, and once again, verify it with someone who owns that same machine, someone that you trust their opinion, to say, yeah, they come once a year, takes 2 hours, it's included in the warranty, it's all good.
Yeah, lots to think about there, because as you said earlier, if we have an hour where our device is broken versus an entire day, that looks very different on our revenue stream in our appointment schedule.
That's right.
Mm. So then tell me about secondhand devices and resales, because this is something I'm seeing a lot more conversation around in our community. What are the pros and cons of purchasing a device secondly rather than firsthand?
Okay. Well, it might sound surprising coming from someone managing a device company who wants everyone to buy new, but there's actually a lot of good news in having a robust second-hand market for devices. It's actually good for the industry. And the reason I say that is that having a reseller channel actually makes it easier for people to get into new equipment for two reasons. One, if you want to upgrade or you want to something isn't working for you anymore and you just want to get rid of it and move on, if there's a robust reseller channel, you've got somewhere to go, like selling your car secondhand. You know that you can offload it. There's a mechanism in place. The other thing which a lot of people forget is most people borrow money to buy these devices. They're very expensive. And one of the things that gives the lenders comfort is that should things go wrong, that they have a mechanism to offload the equipment to recover, the debt. And so that is why the secondhand industry is actually very useful. It actually helps all of us. The biggest downside to secondhand is that most device companies, to be honest with you, I would say Candela is an exclusion to this, and especially the small distributors, have no interest in supporting purchases of secondhand devices. And the reason for that is the way their businesses are structured. They don't invest in the infrastructure necessary to support owners of older machines that have been purchased secondhand. They're not interested in that because that's a whole separate set of infrastructure you need to build in your business. You need service engineers, clinical people, you need parts, third-party logistics. There's a lot of cost base for a company like ours to support people who have bought one of our lasers secondhand and never bought it from us in the first place. And you can only really do that once you've got a large install base and you've got volume. It's an economies of scale proposition. So a lot of the smaller companies, all of the resources they have are salespeople, admin people, inventory people, maybe a clinical educator, maybe a tech to fix them when they break. There's nobody in that business who's really interested in looking after someone who bought a secondhand device. So that's one of the biggest cons to secondhand. The other thing is, once again, I go back to the 3-year cost of ownership thing I mentioned earlier. You can buy a really cheap device that looks like it's way cheaper than a new one. But then when you look into it and you think, hang on a minute, I've got to buy a service contract, I've got to buy consumables. And some companies have all sorts of things like recertification fees where they won't create a relationship with you, supply you with parts, consumables, any sort of support, unless you pay this big fee to essentially establish a relationship with them because you didn't buy it from them in the first place. So look out for that. You could find yourself with a cheap device, but when you actually have a look at what it's going to cost you, it suddenly becomes much closer to a new one. So really look into that. The other thing is a lack of access to clinical education and support. You're buying off eBay or some dealer who's literally just a middleman between the seller and the buyer. The company's not involved. You don't have that support that you would get if you bought new. The other thing is we need to remember is these are medical devices. There is a regulatory component to this with the TGA. And if you have an adverse event, if you burn someone on your IPL machine, there are a lot of rules under the Act where the company that you purchased it from needs to be able to support you and have a quality management system in place to record all of those adverse events and report it up. And if you buy just from some random, that mechanism isn't in place, which potentially puts you at risk both with the TGA and also from a medico-legal point of view with your indemnity insurance. So there are a lot of complexities that people aren't aware of when you just take your chances and buy something secondhand.
Yeah, interesting. And I think that risk management part for me stood out the most because if a client, God forbid, something did happen, we burnt her or otherwise, and they came back to the business, if you didn't have that relationship or in that moment, if you realized, okay, that relationship's about to cost me a lot of money,
Yes.
That's a really scary position to put your business in.
It is. And if things got particularly ugly and it became legal and you were turning to your insurer and your insurer said, well, what is the manufacturer telling you? What have you accessed? What official manufacturer training have you got? And you're like, well, none. I bought it from eBay. That insurer could potentially have a reason to deny your claim, putting you at enormous potential financial harm. So there are a lot of, it might look attractive up front. Oh, look, I can get this for a half or a third of what the company quoted me, but when you really look at what it could ultimately cost you, it could end up being the worst decision you've ever made.
Yeah, interesting. Lots and lots of things to think about. This episode has been so insightful. I'm wondering if you have any parting words or thoughts. I mean, I know we are coming into December now and we go into January and everyone goes, new year, new me. What do I need new in my space? And there's going to be a lot of thoughts and feelings around purchasing new devices and onboarding things into their businesses. Any parting words for our business owners out there?
As in what to look for or what's hot at the moment?
Oh, all of the above.
Look, I think there's a really interesting move at the moment on just what the perception of aging and beauty is, if you look at the face. And traditionally, in this country, particularly with our climate, we look for, texture and wrinkles and pore size and things like this. But I think there is a big move for people addressing pigmentary conditions because the improvement in beauty, in the aesthetic improvement that can come from correcting pigmentary conditions is in some ways more impressive than textural and wrinkle type treatments. And that's one of the most fascinating areas of technology at the moment, is what we can do with pigment and how we can correct things that we could never ever do before. So I think that's a very exciting development.
Yeah, interesting. Well, I will be telling you as soon as I push this baby out. I'm 6 months pregnant now. I'm developing some lovely melasma on my face. I will be the first person into a clinic to get that pigment removal. So there we go.
Give us a call, we'll help you.
Matthew, thank you so much for coming and having a chat with me today. It's been absolutely divine and very informative. I really think our audience is going to love this episode.
My absolute pleasure. Thank you very much.
One of my absolute favourite things about being able to bring this podcast episode to you all is being able to bring you guests and episodes that you all request. And this one on the comparison, purchase and maintenance of devices is something I'm sure you'll all take great advantage of when diving into your next technology venture. If you enjoyed hearing from Matthew today and would like to find out more about the work that the team at Candela do, or the services that their machines provide, such as body shaping, facial treatments, laser hair and tattoo removal, scar reduction, vascular lesions, or women's health, then visit candelamedical.com or contact the team on 1300 Candela. That's 1300 226 335 and tell them that we sent you. Until next time, stay connected.